Okay, so setting up your meeting for Facebook Live. I'll give us a countdown. All right. I think we are live right now. You want to kick us off, Dr. Albert?
Let's do it. All right. Good morning, good afternoon, and good evening to all the students, residents, physicians, friends of all the above out there. My name is Dr. Andrew Albert. I am a medical director of digestive health here in Chicago, Illinois, and I work very closely with AMO. I'd like to allow the other panelists to introduce themselves, and we'll get the panel underway. The topic of today's conversation is an in-depth exploration, practicing medicine in the world of COVID-19, a day in the life of a family doctor, and a look at what makes an AMO experience a fantastic experience. We'll start off with Dr. Brad Lipson. Brad, you want to go ahead and introduce yourself?
Yes, I'm a family physician in Boca Raton, Florida, and it's nice to meet you all, and I look forward to talking more about AMO with our wonderful team here. And I would like to introduce Raad.
So, hey everyone, hope you're all doing good. It's good evening, my time, it's 8 p.m. here, and all my friends watching. So I'm Raad Al-Hamoud. I'm a final year medical student who studied back there in Saudi Arabia. Currently, I'm stuck in Jordan, and it's my final year. So I'll be talking about my wonderful experience with, the great Dr. Lipson, and of course, how AMO helped me make this possible.
Thanks, everyone. And I am the resident representative from AMO, the only non-physician on the panel. My name is Ben Bradley. I'm Chief Operating Officer at AMO. So I'm basically responsible for everything from the moment you set up a rotation with us to the moment you're finished, and even afterwards, helping you get your LORs uploaded to ERAS, everything like that. We will talk about a little bit how some of the programs we've offered have shifted in COVID-19, and then also, how we've been able to get new types of experiences to make sure students get the LORs they need for that match deadline coming up. So happy to be here.
Awesome. Thanks, Ben. Okay, so let's go ahead and get started with Raad and Dr. Lipson. Why don't you walk us through, so from what I understand, you both work together in a clinical experience. Dr. Lipson, why don't you share with me what your practice is like and what your experience was like having Raad in the practice with you?
So being family practice, you get to see pretty much everything from, pediatrician, pediatric patients to geriatric patients. And also our practice has a lot of bariatrics or weight loss. And we also have a lot of headache medicine, as well as diabetes, cholesterol problems. And also when Raad was there in April, we just started the COVID epidemic here in the United States, down in Florida, where I am located. So obviously we had a lot of new problems and interesting cases to solve and treat patients. So definitely Raad and the other two students were invaluable and very helpful in their respects, as well as seeing the different patients and the different presentations, which I'm sure Raad can give us some examples of.
Yeah, definitely. It was very a challenging time, if we can say, during the COVID.
What tell me what it was like practicing during the time of COVID. What was it like for both of you?
All right, so shall I go?
The main issue was at first a shortage of the personal protective equipment, or PPE, since a lot of people didn't have enough stock of the N95 masks or the surgical masks or the gloves or the gowns. So it was important to stockpile that early on, since everything ran out pretty quickly, especially if you're planning on having 3 additional students, so you have to account for all the different supplies you might need. So definitely both, patients were scared to come in, so we had to do some televisits. So we would do like FaceTime or some other type of video conferencing, or even do telephone meetings with them as well, since some people were just petrified about COVID. So once people learned a little bit more and how you would transmitted via, respiratory droplets. And once the media hype died down, I think more patients were coming in, especially if they want to be tested. And of course, that was the evolution as well, because at first we only had maybe the rapid test with the blood, and then availability of the nasal swabs expanded, because at first a lot of the guidelines were only treat, the very, sick of patients, such as the ones that were needing to be tested if they had really high fevers above 100.4. But the people with very few symptoms, they recommended not even testing. But of course, later on, as that all progressed, we had a lot more availability of tests, and the labs were able to turn them around much more quickly. But at first, it may have taken up to a week to get the results. So later on, the testing evolved, and we were able to do more volume of testing, and then try to keep people safe by just testing them in their cars and doing the nasal swab there, so they wouldn't, contaminate the rest of the office or the other patients there. So we definitely had a lot of interesting cases. I'm sure Raad has some examples for us.
Yeah, so from my point of view, it was a little bit like challenging and like different, because first of all, I loved how Dr. Lipson introduced us on our first day. He gave us some coffee and made us feel like we're welcomed, and that helped a lot with our anxiety and stress, and overall talking about ourselves and stuff. So he explained clearly that we should have our PPEs and N95 at all times when we're in contact with patients. Unlike the normal times, you're not really required to wear the whole gear. So that was kind of different. And we always used to wear the gloves. Sometimes we forget to wear the gloves, and Dr. Lipson was just go back and wear them and come back again. So we've seen pretty much really interesting cases. I've been, I had the chance of being exposed to a lot of cases, and some of them were pretty much my very first time to observe. For example, there was this one case where we saw, which was about shingles in the ear, Dr. Lipson, right?
Correct. That
was very interesting. We've seen the skin recognitions that are kind of on the back usually, or on the chest. It was in the ear, and it affected a dermatome. So that was really, really rare and very interesting for us. And we followed up that patient. And not only that, we even had one more other case, an epilepsy. We happened to observe an actual seizure happen in front of us. That was really, unfortunate her, the patient, but it was really interesting for the three of us, my two other colleagues, shout out to them, Aurelius and Elsa. Was really, a different and kind of experience. And we saw how the doctor managed the situation, and how, he directed the patient, and, how to tell other team members not to panic and to actually maintain the actual, case without, panicking, because that's all about, leadering, and it's a part of being a physician. And one more case I'd like to mention that was about, I wrote it here. Yeah, a patient presented with reduced hearing, and he was pretty much worried, and he was like, what's wrong with me and stuff. And then Dr. Lipson was like, okay, Raad, just pick and look into the patient's ear, physical examination, just like a normal physical examination. So I've done that, and then I came to be surprised that the patient had a lot of earwax. So Dr. Lipson was like, okay, we're gonna do something magical. And he taught us how to do the ear lavage. And we actually had the chance to actually do the procedure, my colleague Elsa and I, and of course under his keen supervision. And the patient was astonished. He was like, wow, I feel like I'm born again.
It's actually those things that make a big difference.
Yeah. It
sounds like Dr. Lipson was looking out for you and really hoping to give you the safest possible experience, which I think is pretty amazing, Dr. Lipson.
Yeah.
So thank you for that. What would you say, Raad, from your standpoint, are some of the most, the most defining characteristics of practicing medicine with Dr. Lipson as opposed to back at home? What things stood out to you that were just eye-opening and different and invigorating for you?
Yeah. Oh my God. There's a lot. So first of all, like how Dr. Lipson showed interest in knowing me more. Like he asked me about my culture, and he was pretty much interested in everything about like how I use. I mean, like what am I back home about the culture? How's medicine like in back in the kingdom, and like such things. And then I was surprised that in the US, it's like pretty much very mellow for a patient to, talk about alcohol use and, like having multiple sexual partners, and also like, the sexuality of a patient as well. We don't actually see that much of openness in, in our part of the world. It's pretty much very, if I can say, closed, and restricted. So that gave me the chance of like asking patients and to build a rapport with them and gain their trust, and actually like the introducing questions. For example, Dr. Lipson used to do is like, how have you been feeling lately? Are there like any life stressors you're having? Because, in family practice, as we came to know with Dr. Lipson, you see all kinds of cases, even psychiatric ones. So, anxiety, stress, depression, all of those really count. So having you ask that question, opens up a lot of things, and like it becomes the window for you to go ahead and ask even, more personal questions for the patient. So that was really much a very like an eye-opening, and I was kind of like, surprised about how easy it is to ask such questions. I don't really have the chance. And even like the procedures that we were allowed to do under his supervision, like, we did a lot of urine toxicology, EKGs, the ear lavage, and even incision and drainage. We even see dermatological cases as well. And phlebotomy, oh my goodness. My very first phlebotomy work was with Dr. Lipson. He pushed me. He was like, go ahead. If you didn't do it now, it's your chance. So why not try? And I was, and my colleague, one nice thing that was about, the rotation is that we were like a group of students with Dr. Lipson. We were 3. So it was me, Elsa, and Arelis. Elsa volunteered to be my patient, and I withdrew her blood for the very first time ever, and it went perfect. And Dr. Lipson was like clapping for me, literally. I really thank him for this chance. Thank you so much, Dr. Lipson.
Go ahead, Raad.
Yeah, so I was saying, I had even more chances and more exposure ever. Like, I said this before and I'm gonna say it again. This 1 month equals my whole year, literally, without any exaggeration. Yeah.
So would you say that you're prepared for your residency, given your experience with Dr. Lipson?
Oh, of course, like especially for the clinical skills.
Yes.
Goodness sake, yes, definitely.
Fantastic.
Very confident.
Fantastic.
And even we had the chance to exchange experiences with my other colleagues, because one of them had her USMLE Step 1 done, and she was studying for her Step 2 CS. So we actually, when we had some free time, we took permission from Dr. Lipson, and then we used to go to one of his rooms and close the door and then practice how the test is like, from the experience of that. The third student, who was Arelis, she has done her Step 2 CS. So she was like telling us how it is like in the exam, and she like made a simulation or a mock exam for us. And that was really, really so beneficial.
Yeah. Thank you for sharing that, Raad. Dr. Lipson, tell us about your experience with AMO. Tell us what you love most about your experience with all the different students that come from across the globe. How has your experience been, and what do you love most about it?
Well, I think growing up in Miami, it's very multicultural, a melting pot, so you get exposed to a lot of cultures. So that's what I've really been instilled with my whole life. Even my wife is Chinese, so I like learning about different cultures. So I think it's important to give a chance to people from around the world to really experience the US instead of just having a certain perception of it. So it's better to experience it firsthand and really see the diversity that we have here. And like Raad was saying, the openness to talk about different
Doctor,
situations.
you
as
made
well.
me teach you some Arabic.
Shukran.
Yeah, how fun.
So definitely it's important. And then, you know, we also got to share a lot of lunches together. So we different days we would pick, oh, let's have Cuban or Mexican or Greek food or Thai food or Indian food. So, you know, we had a trip around the world as well, as far as our daily lunches were concerned as well. So we could definitely converse and get to know each other person to person instead of making it so formal, and kind of become more friendly and collegial, and really build up, you know, the spirit, so people stay motivated, and, you know, students really enjoy their time here and really experience the whole variety from the different patients, backgrounds, and also learn from them too, because, you know, they tell you their story, and most of the history will tell you a lot of their issues or diagnoses or things going on with them. So you really have to learn how to establish a rapport, and maybe even talk to different types of people in the US. So maybe you have to approach it differently or say it in a certain manner. So you have to kind of coax these things out of the patient. So it takes experience to learn how to converse with them and build a rapport as far as the doctor-patient relationship. So that's what's really invaluable for the AMO students to acquire as well during their time with us during the month.
Yeah, no, so that's really, those are some great points, Dr. Lipson. I personally find that the students not only learn the textbook medicine part, but they also learn the clinical medicine, the real medicine, the medicine behind the textbook. When you determine certain etiologies for illness that you can't read in the textbook. But there's also the cultural component, which is helping students understand American culture, which is mixed. There's a lot of different cultures in America, and we at least I know we try to give students the cultural experience of what it's like to have more exposure beyond where they're from.
And everyone's so friendly, and it's so beautiful. I love it.
Yeah. Thank you.
Yeah.
Thank you for that. No, I think we're very proud of that. I think it's safe to say that we provide a very different experience at AMO, that the experience is not just the clinical one, but it's more about becoming a better person, a better doctor, beyond just learning how to treat, in my case, acid reflux or colon cancer. In your case, different infections, and you know, asking about alcohol consumption. I think it's a no-brainer that the experience is multi-pronged, right?
Definitely. I actually want to mention one extra thing I forgot to mention. Dr. Lipson just said a while ago. One thing that made us like build ourselves as a team and work as a team is the lunch breaks he used to do for us. It was like a lunch and learn session, and, you know, alongside some cortadito. That was very beautiful. And he actually introduced us to other team members. It was my very first time to know that there would be such a specialty as a nurse practitioner. We met over there, and another ER attending who usually was he was amazing, Dr. Mulavi. He like used to show us some cases and like simulate us and teach us some other stuff about, you know, health and, you know, losing weight, like using the BMI machine and the metabolism rate calculator, like how much you burn at rest and that kind of stuff. That was really, really so exceptional.
Awesome. That's really awesome, Raad.
Yeah.
Let me shift gears for a second. Let's talk about the clinical experience and just things like USMLE and the benefits of the rotation, LORs and whatnot. Ben, I don't know, or who should speak to the USMLE requirements for international students. I know Raad had some things he wanted to share. Do either of you want to comment on that?
Definitely. So like the overall picture is to enter into the US healthcare system as an international medical graduate, you actually have to do the USMLE, which is composed of like 3 steps. Step 1, and then step 2, which is further bifurcated into 2 things, step 2 CS, and then step 2 CK. And then you have the last exam, which is the step 3. So the step 1 you can actually do in your country, wherever you are. And step 2 CK can be done also outside the US, but step 2 CS has to be done only in the US. So it would be actually smart for you to do something is that you also need to have at least like 2 or 3 rotations as experience of being exposed to the US healthcare system in order to apply for a residency program. So what you can do, and actually is really smart, is take 2 or 3 rotations, and then, to get yourself that, LOR, and then meanwhile, you can actually give your step 2 CS. So it's basically clinical skills, and it's not really that much of, you don't need that much of studying as most students would think. So that would be really a very, smart move.
And just to add to that, Rod, so for our experiences, whether or not step one is required is really dependent on the type of program and the location. So for some of our hospital programs, you're going to need step 1 before you can actually attend. Now, it's tough because a lot of students don't take step 1 until after they've graduated, and then it becomes more complicated with the visa. However, we have plenty of programs that you can do without step 1. And I think, maybe Rod, you can speak to this a little bit more, but now that the step 1 is moving to pass fail, these rotations and your other scores just become so much more important. So the quality of the bond you're able to make with your preceptor, that's going to make sure you have a better letter, and a better letter is going to increase your chances now that you can't differentiate on step 1. So I think it's just gotten even that much more important to get really solid clinical experiences.
Definitely, Ben, that's right. So I myself haven't done any of these steps. I'm still like an undergraduate. So I still have the chance to do, rotations and get the, US clinical experience with you guys. And definitely, since the US, step 1 is going to be a pass and fail, then the other, points are going to be valued more. For example, just like the rotations. So doing more rotations and having better LORs, as you've said, is going to weigh more than, the step 1 basic scoring, which is going to be pass and fail for the match system. Definitely. Yeah.
If I can interject a little, I just want to make sure we cover 2 more points in the time frame. I want to talk about the letters of recommendation, because I think a lot of people are very interested in that. Dr. Lipson, can you just comment briefly about the letters of recommendation? What do people need to show you or demonstrate as they hope for a positive letter of recommendation?
I think definitely not only, learning the clinical skills and, learning to be on time, or being able to converse with the patient, but also just establishing a rapport with the attending. So also interacting with the other team members, like the medical assistants or the nurses or the other staff that might be there. All go into it because, medicine's a team sport, so we all have a part to play, and we have to learn how to play well together and interact for the benefit of, taking care of the patient. So I think overall, attendings want to see that you're motivated, you're interested, you're there for the right reasons, and you're putting a lot of hard work into it, and you're staying on track, and you're just showing them that you care about the patient and the whole process of caring for patients, and also interacting and treating them appropriately.
Agreed.
Yeah. Can I add up something?
Go ahead, please.
Yeah, so also from my point, as a student, you should always also ask if you're doing things right. For example, halfway your rotation, you can ask your preceptor attending, am I doing everything the way you want me to do it? Do you see like I'm improving? And if your attending gives you like some topics to like review and revise and discuss with him or the team, you should actually do that, So you actually show a picture of you being, like you're improving, you're actually improving. So that actually makes you like kind of guarantee that you're going to get like a positive LOR. So Dr. Lipson will always, give us some homework, and then the next day we'll do some like discussions. And Elsa used to like bring her like board, and she used to like draw diagrams, and that it was amazing explanation, and we really enjoyed those discussions. And you don't have to stress about anything, if you don't know anything, just, say, I don't know, can you please teach me? And then your attending will be there for you.
Agreed. I think it's safe to assume that if you're interested and you're asking thought-provoking questions or just asking follow-up questions, it just shows your interest. And we love working with people who are interested in what we do. So,
Exactly.
the letter of recommendation really shouldn't be an issue for anyone. And I wanted to add one other thing. There is something to be said about the telemedicine rotation. Currently, I have 4 students in my telemedicine rotation. I have to say I enjoy it very much. It's like a didactic session, if you will. And what I love most about it, so there is a silver lining to COVID in the sense of what has come out of it. And that is that when the students are all together, they hear each other present. When they hear each other present, they get to learn from others from around the world. So my students are from everywhere, literally across the globe. And so what's so nice is that it allows people to compare what works, what doesn't, what teaching points I make to one person helps another person. So it's been really helpful to actually have many students together because then you're learning from each other. Do either of you have something to say about that?
Yeah, can I?
Yeah.
Yeah. So that is actually very true. And above of like learning from each other, it actually encourages me as a student, like to see my peers, my other colleagues, how they're performing and stuff. Because like in my mind, I would go like, oh my God, everybody's perfect. Maybe I'm gonna be, I'm not gonna fit in and stuff. So I like stress about it a lot and overwhelm myself. And then when I actually go into real life and get the exposure and get more than one student participate and stuff, I find myself, no, we do share something in common. We're all students and we're here to be improved, So it really gives you a lot of encouragement and it gives you this, friendly feeling with medicine and the whole experience.
Yep. Dr. Lipson, anything to add? Or if not, it's okay, because we can move on to the forum.
We can proceed.
Okay.
Yeah, I will just say one thing about telemedicine that we've heard from a lot of physicians and students. For a long time, telemedicine was kind of this add-on that certain practices offered, some didn't. But I think what COVID has done in the US has really accelerated that process about 10 years in the space of 6 to 8 months. So where, and I'm sure every doctor here can tell you, there are certain doctors, they tend to be older, they never want to, they don't want to change. This is how they've done things. This is how they've done them for 30 years. They don't want to change. Those doctors, because of COVID, were forced, like Dr. Lipson said early, patients weren't going in. So everybody had to learn telemedicine. And what that did is that put the structures in place for these virtual rotations to occur. And even if you're not doing a telemedicine visit as a physician preceptor, there are now, you spoke about FaceTime, you spoke about phone calls. You can get a lot of didactic experience just from that. And maybe you don't have the resources to come to the US. Maybe you have visa issues. There's still an opportunity with this kind of new development to get that experience. So I would definitely kind of point that out as one of the silver linings that we've really evolved through telemedicine so quickly because of this.
Especially been now in that time where students are like halted right now. Some of them are not even allowed to go to hospitals and actually practice. Like in my country, in the kingdom, when I was practicing with Dr. Lipson and having rotations with you guys, I had some of my friends sitting back at home doing nothing because they're not allowed to go to, the hospitals during this pandemic. Yeah. So it would be really smart for, students to practice more their clinical skills and stuff around that to actually take a telehealth. Like Dr. Andrew said the other day, he can actually show the student what sign to look for and elaborate more, get better chance of, looking into the thing.
And Raad, that hasn't changed. We had a question in the chat about how long do people think that teaching in person will be impacted. So to give you an idea, in our programs, at the start of COVID, a little more than half of them were pretty much shut down. Now we've gone through and we've opened up certain programs based on their screening, the number of COVID patients they get, do they have adequate safety measures in place? And Dr. Lipson's was one of these programs. But for a lot of schools, like Raad said, even US schools, away rotations were pretty much entirely shut down. And they frankly could be shut down until next year. So, a question we're getting, how does that impact LORs from telemedicine? Can I still get a good LOR from telemedicine from virtual? yes, you can. And it's going to be very, very common in this year's match because even the US students couldn't get their away rotations this year.
Nice.
My sister is a medical student right now. She's taking a virtual rotation over Zoom. It's a very common thing. So I think it's still a great experience. And that's kind of the reality of COVID that we're in. The hands-on and the in-person is limited, but you shouldn't let that deter you from getting the training you need.
Exactly. I'm actually thinking of taking one as well.
That's great.
Yeah.
All right, so should we move on to any open-ended questions, Ben, that people may have entered into the forum?
Yeah.
Sure. So I think one right here, we had a question we have physical therapists in the office and in the chat. Hello, physical therapists. We do have a couple physical therapy programs. The visa issues can be a little bit tough, but speak to an advisor and we can help you out. I think we have another question, which is a common one we get. Does AMO provide jobs? So I think I'll tell you what AMO provides, and then maybe Raad can tell you about his goal and what he wants to do with an AMO experience. So AMO provides the experiences, the infrastructure for physicians to host international students and get those letters of recommendation. We don't set you up with a job, but we give you a tool, a piece of what you need to get that job later. So Raad, maybe you can talk about what you want to do. Yeah, the opportunity, exactly.
Exactly. So yeah, so my goal was actually to know how the U.S. medical system works and how is it like, and to better understand things and be better prepared for my residency program. So through my rotations, I got the chance to meet other local residents who are actually rotating like in medicine, and others were like in family medicine and neurology as well. We even had some of them as patients, and they were so cooperative and so friendly. And some of them were even previous IMGs. So you get the chance to actually ask them questions and how their whole pathway was like. And not only that, you actually will have also like some other chances of meeting people, build your personal connections, which is really very important, for your future career. So if you were like really, really good and your attending likes your work and he likes what you're doing, he can actually tell you or guide you. He or she can guide you like where to go and what to do for residency, and they can ultimately give you an LOR, and they might want you to work with them. For example, if they're like at hospitals, they can actually tell you can apply for that residency program. So I mean, there are a lot of benefits to this kind of rotation, like to do an actual rotation in the US or a telehealth to better understand your attending, how has he or she became whom they are.
Yeah, I think that's a great lead into this next question, which I'm going to direct at the former residents, now attendings, and now running their own private practice, a business in the United States. So one of the questions we got was, how is the U.S. system different than some of the other systems? And I think we talked about some things, but there's one thing I want to highlight. Can Dr. Lipson or Dr. Andrew Albert, can you tell us what the difference is between working as a resident or as an employee of the hospital, and then versus going out on your own? Some of the things you have to think about, maybe the ways you have to adjust your thinking, some new skills to develop.
Sure, I could do that. At first, being a resident, you're all focused about learning the medicine and passing your board exams. And then you enter the real world of either joining a group practice or trying to start out on your own. And, of course, with the medical insurance, the way it is in the US, it may take 6 months to a year to even get on some of the panels and be able to accept patients with insurance, such as Medicare, the other insurance companies here. So that's when the business side of medicine that they don't teach you in medical school comes into play. So that's why a lot of physicians later on, get other training in business, such as getting their MBA, so they could learn more, the Masters of Health Administration, so they could learn more about the business side or the insurance side with the billing and the coding. So basically not only caring for the patients, but also making sure things are covered, or if the patient has a deductible, or what the patient's co-insurance or copay might be. So it's a whole different world as far as the medicine versus the business. So it's kind of like on-the-job training when you're in your residency, depending upon if you're outpatient or if you're in a hospital system. You get to learn the different facets of the business side of medicine.
And remember,
Go ahead, Raad.
okay, sorry. I remember Dr. Lipson was, he took his, like, some time to teach us, you know, the interface of the computer and how to enter the information of patients and how to do prescriptions and all stuff around that. Yeah, it's a pretty much complicated system that you really need to learn before, like, a head residency. Thank you for that.
Sure, my pleasure. Yeah, the electronic medical record, that's different for every office, depending upon where you go to, but it's all going to have similar capability, not only writing the SOAP note, but also doing the prescriptions and the labs and the imaging, as well as referrals. So that's a key point of modern medicine nowadays. It's, you know, no more paper and pencil like nowadays.
Yeah.
It's interesting. I know we have to wrap up shortly, Ben, but I know one of my students wanted to ask me all about GI fellowship, given that I'm a gastroenterologist. And I appreciate these questions so much because you just want to know, you just want to plan, right? But the truth of the matter is that you will get there. Like, you will learn all these things along the way. And as much as you want to be proactive about figuring it out now, right now, just do your rotation with AMO, get into the office. And once you get there, you'll see that everything will get easier. But it's hard to plan that far in advance, given that there's so many stages. As far as where you'll wind up, the truth is, it depends on what specialty you choose, because some are very academic focused, some are private practice focused. So I think that's a hard question, Ben, because I think that people want to anticipate, but it really depends on the specialty or the specific area you go into, and there are so many. So I'll just leave it there.
Yeah, I think that's a great place to end, Dr. Albert. So thank you, everybody, for joining. I hope this was very informational. Again, if you have any questions, you can message us on Facebook. You can email us at advisors@amopportunities.org. You can chat with us. We have our WhatsApp numbers on the site. Thank you all for attending, and keep an eye out for the next episode of the AMO Physician Panel. So thank you all for being panelists. We really appreciate it.
Definitely.
And thank you, Dr.
For
Albert.
this opportunity.
Sure.
And thank you, Dr. Albert, for hosting again. You're
No
a great
problem.
moderator, as always.
Yes.
All right. Thank you, everybody. Bye-bye.